Providers are asking us the same question. Can we bill RTM with SoftSpot? Watch this video to learn what's working and what to avoid. Welcome to SoftSpot RTM reimbursement.
So hi everyone, thank you so much for joining our RTM webinar. This is the first episode of a continuous series of RTM webinars where we'll be discussing what remote therapeutic monitoring codes are and how providers, pediatric providers, can take advantage of these codes to be able to obtain reimbursement. We are joined by the co-founder and CEO of Pediametrix, Dr. Reza Saifabadi. Hi, Dr. Reza.
Hi, Mehrab.
How are you?
Great, thank you. How about you?
Doing well, thank you so much. So, Doctor, if you don't mind, please introduce yourself. The listeners would love to know more about you. And also, I believe you wanted to talk about the importance of these RTM webinars and why we are doing this webinar today.
Sounds good. So thank you so much, Mehrab. So my name is Dr. Reza. I am co-founder, CEO of Pediametrix. Just a quick background. So we started Pediametrix based on a personal experience as a parent. And my older son went through head-shaped deformities, and through that process, we learned that there is a need for a technology that can help not only providers but also parents to raise awareness about this condition. So in 2022, we got FDA clearance, and ever since we have been kind of sharing our what SoftSpot is about. So right now, SoftSpot has been used about 100 clinics across the US. More than 5,000 users have used SoftSpot, and one of the important piece of this technology to be adopted is a reimbursement path for providers. So right now, most of our customers are physical therapists or occupational therapists, chiropractors, and also some pediatricians. So one of the amazing opportunities we have come across are RTM codes, which we will learn today more about. I'll be happy to answer any questions that come.
Absolutely. Thank you so much, Dr. Reza. So if you have any questions regarding anything, how to get reimbursed, what RTM codes are, if you have specific questions about your state, feel free to type them in the chat box. We'll gather them and respond to them accordingly. If we are not able to respond to a question today, we'll talk to our team and send you the response via email or contact you. And again, this is going to be an ongoing webinar, so in future episodes we'll dive deeper. We would love to have providers who have used RTM webinars successfully join us. So if you are a provider who has used RTM webinars, please let us know. We would love to have you as a guest speaker in our next episode. So without further ado, I'll be sharing my screen momentarily to again do a brief presentation on RTM codes, how they apply to a SoftSpot in your practice. Dr. Reza mentioned that a lot of different kinds of pediatric providers are currently utilizing SoftSpot, from lactation consultants to pediatric PTs, OTs, chiropractors, pediatricians, osteopaths, and so forth. So RTM codes are remote therapeutic monitoring codes. They gained momentum after COVID, and these are ongoing reimbursement tools that can be utilized by you in your practice. They are being utilized in different states. We would love to learn, again, if you're in a specific state, what the process is for you to go for these codes and how successful you are, and whether you are using any specific wording or utilizing any tips to bring the success rate higher. So the two CPT codes associated with the RTM codes for SoftSpot are 98980 for the first 20 minutes of RTM service, or remote therapeutic monitoring service. And then there is 98981 for any additional 20 minutes of service during the same calendar month. So again, the two CPT codes are 98980 and 98981 respectively. For 98980, which is again the main CPT code here, the time allocation is 20 minutes. There needs to be at least one interactive communication with the patient or the caregiver during the calendar month. The minimum time requirement is 20 minutes. For example, if you are again a provider practicing in the United States, the average reimbursement is about $50. It is also covered by Medicaid. I know some states vary depending on availability of Medicaid, especially California, I believe, is one of the examples. So again, we would love to learn how you are trying to get reimbursed with RTM codes and whether we can also assist with improving the success rate. I just also want to note that text messaging and emails do not qualify as interactive communication. Also, we would love to share here that the reimbursement success rate and the amount really varies by state and depends on your provider, as well as the qualifications that are needed from insurance companies or Medicaid. So this is not like a flat rate across the board. So there are no established patient requirements for RTM codes. There's also no requirement for a 16-day data collection. And I believe this applies to Medicare. Patient consent for RTM services needs to be documented, and an acute or chronic condition needs to be monitored on an ongoing basis. Again, with 98980 requiring at least 20 minutes of ongoing time being spent going over the SoftSpot reports and communicating with the patient. The qualifying activities, and again, these count toward the time requirements, that 20 minutes for 98980, include reviewing the patient's activity and the progress data, analyzing the response and adherence of your therapies, making treatment plan modifications based on your monitoring of the data. Again, SoftSpot reports are available to you, so you can go over the reports, you can talk about the results, and so forth. And they also include responding to the patient messages and questions, updating any programs or treatment protocols based on your clinical discretion, and direct communications with the patient or the caregiver about the progress. Please keep in mind, and we always talk to providers and tell providers about this, SoftSpot does not make any diagnosis. It's just a measurement tool. We are simply a FDA-cleared measurement tool that enable you, along with other clinical tools and technologies, to make your decision objectively. There are some documentations required as well. So you need to document the total time spent on the qualifying activities. You need to obviously document the date and time, the data that is gathered and reviewed from the monitoring activities, and also the treatment decisions that you make. Any modifications to treatment plans or care protocols also need to be documented accordingly. So we also wanted to talk about one scenario. So again, examples will really help, make this justifiable or understandable on your side. So let's say you spent between 20 or 39 minutes total with one patient, going over all the information that we talked about just now. For that amount of time, you can only bill one CPT code 98980, again, for that initial 20-minute slot of time. But if you go over 40 minutes, from 40 to 59 minutes, you can do 120-minute 98980, and then plus a CPT code 98981. So you have spent here a total of 40 minutes. The first 20 minutes is 98980. The second 20 minutes is 98981. And then if you exceed 60 minutes, you can bill 1,98980 and 2,98981s, and so forth. So again, this visual kind of makes it easy for you to understand the limitations and the possibilities with these CPT codes. Another example we have is for plagiocephaly treatments, which again, pretty much all of our providers are seeing and treating currently. So you need to, again, keep in mind the time spent reviewing SoftSpot measurement data and progress, analysis of the cranial asymmetry improvements or changes, communication with parents or caregivers about positioning techniques, treatment plan modifications based on the SoftSpot data review in the SoftSpot report, any education provided to families during interactive communication, and obviously documentation of therapeutic response to interventions. So again, for plagiocephaly treatment, your plagiocephaly treatment, you can utilize 98980, and if you go beyond 20 minutes, based on the previous slide, you can go bill for code 98981 as well. Again, if you have any questions, please feel free to type them in the chat box. And we are recording this session, so we'll be happy to send you a recording if you just let us know. You can send us a DM on social media, or you can send us an email or reach out to one of our team members, and we'll happily share the link with you. You'll also be seeing parts and snippets of these recordings on our social media, so that we're collectively raising awareness about the importance of reimbursement, specifically RTM reimbursements when it comes to SoftSpot. So another important aspect I wanted to discuss with you is the coordination of care. So again, we know that pediatricians are first in line when it comes to seeing newborns and infants, and a lot of times if they have the tools to enable them to object timely and or rather it's for them to refer objectively and timely, then they can refer to you as early as possible, meaning all of our amazing pediatric PTs, OTs can do their magic. If you're a lactation consultant, for example, you can also utilize SoftSpot to be able to refer to a provider accordingly and as early as possible. Again, the collective goal here is to address any issues early, with the help of objective data and measurements, and address any issues as early as possible. So hopefully we can avoid any unnecessary surgeries or helmets, things of that sort. So PTs and pediatricians can collaborate. We are seeing some pediatricians utilizing SoftSpot to be able to refer to pediatric PTs, for example. There are also some documentation sharing recommendations. You can share progress reports between the primary provider and yourself. So the SoftSpot data can be accessible to both the PT and the pediatrician, for example, or the OT and the pediatrician. You can utilize coordinated care plans, and also clear up any roles, and pretty much huddle with a brainstorm with the provider to see how you can collectively address the newborn and infants head deformity issues together as a team. So again, this enables that. You can both utilize RTM codes to get reimbursed. Pediatricians can also utilize E&M codes and also RPM codes as well to get reimbursed. So with that said, that pretty much concludes the information that I wanted to go over. Again, if you have any questions, you can feel free to reach out to us. We are available, on social media as well with the same handle, softspot.ai. This is also our website. My email address, if you have any questions. I know a lot of you already have my email address, but just in case a provider who wants to, learn more about RTM codes or SoftSpot, please feel free to share my email address. My phone number is also here if you wanted to have any conversations on the phone regarding, SoftSpot or RTM codes. And I thank you so much for your time. Again, look out for updates about our upcoming events, upcoming RTM webinars on our social media. We'll be announcing them. And I'm going to leave you right now with Dr. Reza. If you have any closing remarks, we are at your service.
Great. Thank you so much, Mehrab. I think this is amazing. So like Mehrab said, this is the first of many episodes we are going to have on reimbursement. So feel free to reach out to us if you have any question.
Yes.
Thank you.
All right. Thank you so much again, everyone. And we look forward to seeing you in our next episode. And we look forward to also having some speakers in our next episodes. Have a wonderful rest of your day, your week, and also happy holidays to everyone out there. Stay warm and take care. Bye-bye.
Thank you.